Hey everyone, this is Dr. Dolopo. I just want to touch base before I talk about my stroke newsletter. I am off this Friday evening and Saturday and Sunday. It's really important that you know that so that you're planning ahead. A lot of you, I'm grateful you plan on the weekends. I do have the other doctors here who will be available for you. So if you'd like to schedule with them, if you schedule online, please make sure you text 619-341-4341 so that I know that they make sure that they show up and just they always do, but I always want to make sure that everything flows smoothly. My daughter has another dance competition. It's going to be so much fun. So I just posted a newsletter on ischemic stroke and acupuncture. And many of you know that I've been in practice since 1999. What many of you do not know, the majority of you do not know, is that during my internship years in the mid-90s, I worked at I worked at a community medical clinic, and also at our school. At the time, it was Pacific College of Oriental Medicine, which is now Pacific College of Health and Science. There were easily my day 30 to 60% patients who were post-stroke patients. Now, me treating them as intern and me treating now stroke patients at 26, completely different game. I would like for you to please take a look at that newsletter. It shows a very lengthy testimonial from the daughter who wrote the testimonial. The daughter who wrote the testimonial is the woman who wrote the testimonial is a daughter of the patient, and she did her best, I think, to share some subjective findings that are tangible. And also that newsletter has 5 studies from the at least four from the National Institutes of Health Library. So please, the Library of Medicine, or I think that's what it's called. So it's on PubMed, and I was able to find these studies, and I hope that you do pay attention to them. You don't know. I'm 51. I have close friends who've suffered from strokes, and they don't have full usage of one of their arms. We're a jiu-jitsu family. I'm supporting my son today. I'm assisting with his class today at 4 o'clock. There are people who I've trained with people who have no arms, no legs. But if you're an able-bodied person, trust me, these are important. I play the violin, and these arms, these hands are so important. And it's better to prevent a stroke. The newsletter talks about how acupuncture, the studies show what acupuncture can do for people who've suffered from a stroke. So please read that. But I do want to share in this video that if you can, live a healthy lifestyle, keep your blood pressure low, keep your cholesterol in check, your thyroid, your blood sugar, all that. This is something that acupuncture, Chinese medicine, the right Chinese herbal formulas that are prescribed from someone licensed who knows what they're doing. You're not just buying these haphazard things unless you do a lot of research. But Chinese herbs is significantly different than just buying something, some supplements. Okay, so something to consider. We can talk about that privately. But 1, please check out the newsletter. 2, read the newsletter's testimonial from the stroke patient's daughter. 3, I do want to share that I did not treat the patient until she had in November in another country. I did not treat her until the following August. So if you do know someone who suffers from a stroke, obviously go to the hospital right away. But as soon as you're released, you might want to consider acupuncture. This is something that I have found since 1994 to be really beneficial for the quality of health, the quality of life. You know what I'm saying? It's like this is something where you want to focus on being healthy. It does take time. It does take effort. It does take work. Some stuff has been going on with someone very, very close to me, and he's cooking every night now. He's cooking every night, and I'm so happy. He's cut out, caffeine. He's a coffee. He's cut down significantly on soda, and significantly on alcohol. It is important, especially if you're over 40, to really we need to really start paying attention to how we live. I don't want to make it sound like I'm harping on your health, but better to be preventive than suffering a stroke and now having to live a life where it's you're lucky if you still have your hands and can function like nothing happened. But I think we all know, maybe the majority of us may know someone who may have suffered a stroke, and they may either have passed away or their body's just not the same. And yes, acupuncture can help with the recovery, with her rehabilitation, along with other types of rehab. Physical therapy, occupational therapy, other types of, speech therapy, all kinds of things. I'll leave it up to you to read the newsletter and those studies. But, prevention, and if there's an unfortunate case of having had a stroke and the person's life isn't the same, acupuncture I have seen many patients. I was the first licensed acupuncturist at Samahan Community Medical Clinics in Mira Mesa and in National City, and I'm proud of that still. This was back in the late 90s, 99 to 2000, 2001, and I was able to work with the majority of it was primarily Filipino culture. Filipino food is not the healthiest. I call it the Southern comfort of Asia. I don't make it a habit to eat a lot of Filipino food, if at least once a month, maybe. I love Filipino food, but it's not the healthiest. It's fried, it's oily, and there are some dishes that are healthier. You have to modify it, but it's high in salt. So if you come from a culture where there's a lot of salt, it's fried, consider changing. I do check my blood pressure, and it is around 115/70, and that's average, and sometimes it's lower. I had my blood pressure checked at a clinic a few weeks ago, and it was 135/90, and that was, or 80, 135/85, and that was alarming to me. So I made changes, and the very next day, it could have been the white coat syndrome. It could have been something was off with their cuff, but that was enough for me to remember, okay, I'm 51. I'm not 31. So even myself, your acupuncturist, focuses on my health. So exercise, meditation, living a great lifestyle. So, and here comes my first patient. Good morning. So just thanks for checking out that newsletter, and please share it. All right, you take care. Have a great day.